Welcome to the New England Journal of Medicine at the annual meeting of the European Society for Medical Oncology. I'm Stephen Morrissey, Managing Editor, and I'm talking with Eric Rubin, Editor-in-Chief, and Oladapo Yeku, Associate Editor of NEJM Evidence. We're looking at the Top Gear study, Preoperative Chemoradiotherapy for Resectable Gastric Cancer. Yeku, although gastric cancer is unusual in many Western countries, it remains a common tumor in other parts of the world. So what was the question asked in this study?
Steve, this is an important question. The study evaluated whether adding preoperative chemoradiation to standard of care perioperative chemotherapy would lead to improved overall survival over perioperative chemotherapy alone.
And Eric, how did the study work and what did they find?
In this study, patients were randomized to receive either preoperative chemoradiotherapy alone or both pre- and postoperative or perioperative chemoradiotherapy. The primary endpoint was overall survival. A total of 574 patients from Australia, New Zealand, Europe, and Canada were randomized and followed for a median of about 5.5 years. Although there was a higher rate of pathologic complete response in the group that received preoperative chemoradiotherapy, median survival time was similar in the two groups. The adverse events were also similar in the preoperative and perioperative chemoradiotherapy groups. Yeku, this study did not meet its primary endpoint of improving overall survival. Is this surprising?
In some ways, yes. Prior research had demonstrated the efficacy of chemoradiotherapy when used on its own, and although other studies showed that adjuvant chemoradiation did not lead to improved overall survival, this was felt to be due in part to patients not being able to complete the required course of treatment due to cumulative toxicity. This study was able to show improved feasibility of delivering chemoradiation perioperatively after chemotherapy and even showed improved pathologic response rates, but this did not translate into improved overall survival or progression-free survival.
Is it common to see studies where improved pathologic response rates do not correlate with overall survival rates?
Yes, Eric. We see this phenomenon in many solid tumors, hence the importance of carefully selecting the appropriate endpoints in studies of this size. In solid tumor malignancy trials where definitive therapy is being offered and there is a risk of excessive cumulative toxicity and overtreatment, primary endpoints like overall survival are the most appropriate for exactly this reason.
Thank you, Yeku. Thank you, Eric. The report of this study is now available at nejm.org.